I'm just really excited to be here today. We're going to have a very fascinating and useful conversation. I don't know why, but co-occurring has been on my mind recently, and I haven't heard a lot about it. And I thought this might be a good time, to discuss the issue. And then I heard Kevin speak about, we were doing some, personal sharing and in the state leadership team meeting, and that kind of sparked a thought in my mind. And I thought that Kevin would be a good speaker on this topic. And then of course there's Jamal, and probably most of you know Jamal. If you've ever been to a webinar, you know Jamal. And so it's going to be interesting. And we're really glad to have you all with us today. So today's webinar is it substance abuse? Is it mental health, or is it both? Provided by the PA Care Partnership in association with the Office of Mental Health and Substance Abuse Services grant. At any time during a presentation, please type your questions into the Q&A feature, which you will find by running your mouse along the bottom of the Zoom screen. Today's moderators are Jamal Ford, whom I've already introduced, and myself, Nancy Massey. We are both with the PA Care Partnership grant. Today we'll be speaking on understanding what co-occurring is, where it begins, and how it grows. You will walk away knowing when a mental health issue exists, whether diagnosed or not, how we are at risk of substance addiction, why a substance abuse addiction can trigger a mental health issue. Often youth using drugs and alcohol are too young to understand or believe they are at risk of addiction. We'll talk about that. And this is an important one. Once you get on the road, there's no getting off. You may be able to control your addiction and your mental health issues, but they always will be with you, waiting for an opportunity to knock you off the wellness wagon. So I'm going to introduce our speakers. First is, wait, I forgot this part. Here, Kevin Piskarek. And a lot of you probably, did I mess it up too badly, Kevin?
You were close, Piskarek.
Thank you.
Yep.
A lot of you know Kevin. You've probably worked with him or seen him in action. He's with Youth Move PA. Kevin is an individual in recovery from substance abuse disorders and mental health challenges. He will share his story with us today as we learn about co-occurring disorders. Kevin was trained as a certified peer specialist in 2017 and worked with youth and young adults at AMI Inc., where, among other duties, he managed psychiatric rehabilitation groups and supervised the peer mentoring program and the drop-in center. He is also trained as a certified recovery specialist and a certified family recovery specialist. In 2021, he was trained. Kevin worked as the Call for Change and Youth Coordinator at the Pennsylvania Mental Health Consumers Association in unique partnership with the Pennsylvania Peer Support Group. He is currently the Program Director for Pennsylvania Mental Health Consumers Association. With him today is our Jamal Ford. Jamal is the Youth Resources Coordinator for the PA Care Partnership Grant. In September 2018, Jamal became the first Youth Resource Coordinator for PA Care Partnership. Jamal collaborates with youth organizations across the state. In addition, Jamal collects information on what those organizations do so that he can effectively guide counties contracted with the PA Care Partnership System of Care grant in the right direction for technical assistance. Before joining the PA Care Partnership, Jamal spent 17 years at a residential treatment facility. In his time there, he helped to implement the sanctuary model, which led him to an opportunity to learn about trauma-informed care from Lakeside Global Institute through Philadelphia University, now known as Thomas Jefferson University, and the United Way. And Jamal will be sharing some of what he learned in that residential treatment facility with us today. And so I say, please don't forget, if you have any questions, be sure and put them in the Q&A. And then when they have finished their PowerPoint presentation, we'll start taking the questions. Okay, I'm going to turn it over to Kevin.
All right, thank you, Nancy. I am going to share my screen. All right, so thanks again, everyone, for joining us. I just want to say I'm extremely honored to be able to be with you here all today during Mental Health Awareness Month with Jamal Ford and Nancy. I have the honor of working side by side with Jamal and the PA Care Partnership as part of the PA Care Partnership System of Care Grant. Being that it's Mental Health Awareness Month and being able to kind of talk to you all today about the important topic of co-occurring disorders is important to me. Basically because I live it. I come at this work basically from a passion sense, so therefore I have compassion for the work as well. And what I'll say is, Nancy reading my bio, I identify as someone with lived experience, and I used to really devalue that statement when I first came into the recovery process because, and as I got certified, with credentialing with the CPS and a CRS and a CFRS, because, I never went on to go to college, and I'm not devaluing anybody who goes to college and get a degree because that's very tough. That's hard work to do that stuff. I fully understand that, but I really used to devalue my lived experience and felt like I had nothing to offer. I look at that very much differently today. I definitely have something to offer to people. I can definitely support those who struggle with mental health and substance use challenges. I am someone of value and worth today, but it took me a very, very long time to understand that. So I am going to tell you a little bit about myself, a little bit of my story. I'm not going to drag it on and go through a drug log and tell you everything, all the raw, dirty past and stuff like that. But I am going to tell you a little bit just so you can get a snapshot of how I grew up, what my past was like a little bit, and, what addiction and mental health was like when I was younger, and then how I found recovery and what recovery is like today a little bit. So with that being said, my childhood was okay. At first glance, most would say your childhood was great. But a deeper look inside my childhood, I would say is okay. I did have really great parents. Both my parents graduated from high school, went straight into the workforce. My dad worked at General Motors from the time he graduated all the way up until he retired. My mom graduated from high school, went straight into the workforce, worked at West Penn Power, and she worked all the way up until she retired. So they did very good financially. They definitely loved me unconditionally. But, there was definitely still problems in the household. My dad was very, very strict. He was verbally abusive towards my mother, never physically abusive, but, verbal abuse can definitely be tough. So my mother endured some of that. Definitely went on vacations every year with my parents. I do have an older brother. He's 3 years older than me. I'm 41 years old, by the way. My brother's 44. He's about to turn 45 in September. But we went on family vacations every year. I was involved in sports. You can see that picture on the left-hand side. Those are all my soccer jerseys. I was involved in many sports at that age. I think I was about, I'm going to say 12 in that picture. But I really stuck with soccer from the age 5 all the way up until I was 18. I was heavily involved in soccer. My dad was a coach. I really had a passion for soccer. All the way up into high school. I even made the all WIPUL finest 15 all-star team, and even through some stuff that I'll tell you about here soon about mental health and substance use. I really had a passion for soccer. The picture on the right, as you can tell, I'm all dressed up. It looks like I'm going to the school dance to get down and boogie. But my dad always jokes with me. He's like, "Are you sure you're not wearing your friend's suit?" He's like,
that's a baggy suit there, Kev.
I know. I know. So the important thing to kind of notice here, though, is the picture on the right is when I'm first starting to experience onset mental health challenges. You would never notice that from a picture, though. Symptoms of anxiety and depression back then, I really didn't even know it. I was still at that point getting good grades in school. I was on higher honor roll, 9th and 10th grade. Playing soccer still, things are going fairly good. But at that time, I was starting to experience undiagnosed mental health symptoms, and I really had no clue. I didn't have an outlet. I didn't know how to talk about it. I had no one talking to me about it, asking questions about it. And to be honest, my parents were kind of uneducated in that aspect, and self-medication became the option for that outlet. It was the unhealthy option, obviously, but it became the outlet that I chose. At that age, 15, 16 years old, we're going through so many things as a young person. Puberty, troubles at home, some troubles in school maybe. But all in all, I think as a 15, 16-year-old, I know what I was looking for was acceptance. And I was struggling with self-esteem issues, self-worth issues. So I was looking for acceptance from my parents, acceptance from my peers. And on top of that, I was struggling with the onset of mental health challenges at the same time, and then self-medication coming in with, starting with marijuana and alcohol. So with that being said, addiction became progressive. Started slowly with alcohol and marijuana, and it became very much progressive. 16, 17 years old, my parents start to notice. I bring a report card home, and I go from high honor roll to D's and F's, the next report card. And I end up getting honest with my parents, telling them, that I started using alcohol and marijuana. So I ended up getting enrolled in outpatient therapy at Gateway Rehab in Monroeville. I kind of forgot to mention that I grew up in the suburbs area of southwestern PA in a town called Harrison City. It's in kind of close to Irwin, PA, a little bit south of Pittsburgh. So with that being said, I'm going to outpatient therapy at 16 years old, getting introduced to the 12-step fellowship, going to Alcoholics Anonymous meetings because that's all that was there at the time. But at 16 years old, I had no concept of what actual recovery was. I wasn't ready. I didn't know what was going on. So needless to say, recovery did not stick at 16 years old, but I firmly believe that a seed was planted way back then at 16 years old. So time goes on. These pictures kind of portray me years later in active addiction and struggling with mental health a little bit years later down the road in my later 20s. But these are the pictures that you kind of see when I am not well. I am very much in active addiction. The one's a picture, it's actually a rehab entry picture that they took of me when I was getting entered into rehab. The one on the left, the one is a driver's license picture. So with that being said, slowly but surely, I start getting introduced to other substances, whatever it may be, LSD, cocaine. And, when I get into my 20s is when I start doing opiates and crack cocaine. And that's really where I really hit a wall. IV drug use became a thing. And once that started, it was really just about how do I find the ways and means to get more. And that was tough. So this picture is of my adorable son. He is now 14. These pictures are we got pictures done at Target when he was little, and they asked us if he could be a Target model for Valentine's Day. So we said, yeah, absolutely. They gave us the pictures for free. They took a bunch of different pictures of them and stuff, but these are still my absolute favorite pictures of my son. His name's Dominic. He's now 14 years old. Good kid, but we still have our troubles. He's a 14-year-old. He's almost at the age I was when, some stuff started happening, but, I wouldn't change anything with the birth of my son. But what I'll tell you is, as I got older and I'm in active addiction, I'm very much in active addiction when my son is born. He was very much an unplanned pregnancy. I was not ready to be a father. His mother is not someone in addiction, but doesn't use substances. She didn't know I was using substances. So when he was born and she found out that I was using substances, we would always go back and forth. She wanted me to get clean. She gave me ultimatums like get clean or get out, that kind of thing. So shortly before, actually rewind just a little bit, shortly before he was born, I got arrested for a possession charge. It was about a month before he was born, and she gave me the ultimatum to get clean or get out. So I made the attempt to find my recovery process. Needless to say, it did not work. You can try to say, I'm going to get clean for this person. I have a kid, I'm going to get clean for my kid. But ultimately it becomes, you need to find recovery for yourself. And then those people, those loved ones in your life can definitely be your motivation, but this has to be for yourself. It becomes tough and becomes a process. It's tough to do that. But ultimately, if you can't do this for yourself, you're not going to be able to do it for other people. And it took me so long to understand that. So with that being said, years later, my son's 4. I'm still living at the house with them. I'm still in active addiction. And trying to be a father in active addiction is probably one of the hardest things, even a parent, a mother even. It's one of the hardest things to do because you're just sitting there lying to yourself. I couldn't show up for my son. I couldn't keep promises. I couldn't do the things that I was supposed to do to be a role model, to be a caregiver, to be someone that he should be and could look up to. Some would look at this picture and say, oh, you don't look bad. I look at it and I very much know that I am in full, rapid, active addiction, struggling with mental health issues. And I am just there taking that picture to say, oh, I showed up with my son at this Pirate game. for the first time, and this is the first time I see him in 6 months. So I'm going to take a picture and post it on social media so you all can see that I was here with him at this game, you know? But with this being said, at this point, my son's mother had left me, and it was probably the worst thing that could happen. Because this is when the truck just kept rolling forward, and there was no one there to look over me and watch over me anymore. I could do whatever I wanted, and it didn't matter, you know? So with that being said, I was able to do anything I wanted. And that gave me the ability, not the ability, what happened was I ended up losing everything. I lost my place of living. I lost my job. I lost every meaningful relationship in my life. I was homeless. It was probably, I'm going to say it's one of the lowest points in my life. I have had lower points in my life. You know, being that my son, it felt like my son was ripped from my life. And that was probably one of the worst things that could have happened, because I felt like I didn't deserve anything. So why not just throw my life away? You know, it was a tough pill to swallow, to say the least. So we're just going to tie some slides in to talk about addiction and mental health, and then as well as co-occurring disorders. Hold on, I need to go back. I'm sorry. So we talk about addiction being a disease, not a choice. So addiction is treatable, chronic medical disease involving complex interactions among brain circuit, genetics, the environment, and an individual's life experience. So when I'm going through all this stuff, the addiction, I'm doing things I don't normally do. As a young person, especially, I'm acting promiscuous, engaging in very unhealthy behaviors. I kind of didn't mention this, but I did mention the interactions with the police. I got arrested. I ended up getting in a couple high-speed car chases, which that's the part I didn't mention. Driving intoxicated, putting myself and others at risk. Those are those high-risk behaviors that, when I'm in recovery, I don't put myself in those high-risk behavior situations. That's the addiction being a disease, not a choice. So people with addiction using substances engage in behaviors that become compulsive or often continue despite harmful consequences. When I'm in that addiction state of mind, I'm not thinking of consequences. I'm at the most self-centered aspect that I could be, that no one matters except for me. And it's tough for us as loved ones to see that as an outsider looking in. Very tough. I used to try to talk to my parents about this when I first got into recovery, and my parents had a very tough time understanding this. I haven't talked about this yet, but I had some years clean and I relapsed or reoccurred. I had some clean time, and then I went back out and started using again. And I found recovery again, obviously, but my parents were just like, I don't understand how you could go back and throw your life away. It's all about addiction being this disease and not a choice. So mental health, on the other hand, like I mentioned in that picture of me and my friend at the beginning, you can't really see what's going on just from a picture. And it's not always obvious on the surface. It's what's going on underneath a lot of the times. So mental health and substance use disorders affect people from all walks of life and all age groups. These illnesses are common, recurrent, and often serious, but they are treatable and many people do recover. And then mental disorders involve changes in thinking, mood, and behavior. These disorders can affect how we relate to others and make choices. Reaching a level that can be formally diagnosed often depends on a reduction in a person's ability to function as a result of the disorder. So for me, this is going to be different for everybody, but signs of mental health for me were like isolating, not wanting to be around a lot of people, feelings of loneliness, suicidal thoughts, low self-esteem, low self-worth. And this is going to be different for everyone, depending on what mental health challenge you're dealing with. You know, it's going to be very much different. It's going to be whatever's going on for that person. It's going to be individualized. You know, I had undiagnosed anxiety and depression at 15, 16 years old, but I had no clue what it was. And like I said, self-medication became the answer to my problem. And I'll talk about this in a little bit. I went through, I can't even tell you how many treatment facilities, halfway houses and whatnot. I didn't get diagnosed with a mental health diagnosis till I hit 33 years old. So you're talking almost just under 2 decades and probably 16 treatment facilities. I never got diagnosed till the last one I went to. So that's a long time. So now we're talking about putting these two together. And when we talk about co-occurring disorders, some individuals think that we're talking about just substance use and just mental health together. But this can also refer to other combinations of disorders, such as mental health disorders and an intellectual disability. So I just wanted to kind of mention that as well. It's just not mental health and substance use, although today I'm kind of talking about mental health and substance use together. So the coexistence of both mental health and a substance use disorder is referred to co-occurring. I struggle with the fact thinking that like I had a mental health disorder for a while or a mental health diagnosis. I struggled with the fact when I was younger even, and I forgot to mention this, that like when I was say 20 years old and not 20, maybe 18 years old, and I was just drinking and smoking marijuana, that like, I'm just going to smoke and drink some alcohol. I'll never do those hard drugs. I'll never get into that. That's what I always thought. And like years later, there I was doing some of the hardest drugs that are out there. You know, so there's always a rock bottom for me out there, and I have to remember that. And living in today is the best thing that I can do to prevent myself from getting to that rock bottom. But what I can say is that, you know, I'm not exempt from getting there again, and I have to remember that. So anyways, with that being said, the last treatment provider I went to was a halfway house in Washington County. And I now currently live in Washington County. My recovery brought me here years later at 33 years old. And I stuck and I stayed here. You know, I found recovery here, and recovery has been good to me here. So this is where I stayed. But I truly, truly believe that when the treatment provider, the last one I went to, treated both my mental health and the substance use at the same time, it truly did save my life. If I would have went back out and my mental health wouldn't have been treated, I would have been in some big trouble, because I was in a bad spot last time when I came into treatment. And it took, because I had a closed mind when they told me they thought I had a mental health diagnosis. The therapist and the psychiatrist that I talked to, it it took me to be open-minded, but it also took a couple conversations actually through therapy to kind of get me to be open-minded, not only to medication, but to some other wellness tools and some other things to kind of work through this and see what kind of options there were for me. It really did take some time. I will firmly say that medication is not the cure-all. It is definitely a tool for me to get on the road to recovery. So recovery, like one of the things that I'm like most passionate about. I talk about it every day. I have so much passion for this work because I live this work. I've lived through substance use, decades of it. I'm living proof that recovery is possible. Although it seems daunting at times because, look how society is today. It seems overwhelming, but there are people that recover from mental health and substance use challenges. So recovery is a process of change through which individuals improve their health and wellness, live self-directed lives, and strive to reach their full potential. There's 4 dimensions of recovery, and it comes down to health, home, purpose, and community. There's something about in that definition of recovery that like strikes me every time, and it's full potential. The last two words in that definition. I doubted myself so many times in this process. When the last time that I relapsed, I had a couple years clean. I had 3 years clean. I was working in mental health. When I relapsed, I had to step out of the field of work for a year to get my life back together. But I lost my job in the field actually. And I was homeless again. And what I can tell you is when I went back into treatment, it took me 3 inpatient stays, and I had to go back to the halfway house that I lived for 6 months prior. So this halfway house I lived in for a total of a year of my life. What I can say is when I was in treatment the last time, I said, man, if I could just get my life back when I was clean again, if I could just get my place of living back, if I could get my old job back as a CPS, and if I could just get my car back, I was putting a cap on my potential. And what I'll say to you today is that that was a mistake because I blew the lid off my cap. I'm not saying don't set dreams and goals. Definitely set dreams and goals. Just don't get rid of the cap. Because like today, my life is absolutely amazing. Because what happened was I went to the halfway house. I went to the 3 inpatient treatments, went to the halfway house. I got my old job back at the peer provider I was working at. I got my place of living back. I got my car back. I got all my relations back with my friends. I started seeing my son again. Life became amazing. With that being said, I got a job offer to work where I work today. Mind blowing to me. I love what I do today. I have so many good relationships, family, friends. It's just amazing to me. If I would have settled for, the place that I had before where I lived before, and I'm not just talking all monetary, financial stuff, but if I would have settled for the job that I had, if I would have settled for the inner peace that I had, if I would have settled for the spiritual peace that I had before, man, I would have been settling for real. It's just amazing where life is at for me today. And it all comes down to the 4 dimensions of recovery: health, home, purpose, and community. I think when you're talking about those 4, it comes down to reaching your full potential. Just don't put a cap on it. So MAT is definitely a part of my story. And what I'll say about MAT is, for me, and this is just for me, it worked for me when I was on it for a short period of time. I'm on MAT for mental health still. I still take medications for mental health with treatment. So I still do therapy. And therapy is going to be individualized. At first, I had to do it in the halfway house, I was doing it like a couple times a week. But now, when I got out of therapy, I was doing it once a week, and then it went to bi-weekly, and now I do it once a month. It's going to be individualized. MAT on the other side with substance use, I did do MAT for substance use. It worked for me. Doing it in a short period of time. So Suboxone, buprenorphine, short period of time, being on it for like 14 days in a treatment setting, doing therapy, and then coming off it, being weaned off it was the best way for me to do it. Now, I understand people do need to be on it long term. It is saving people's lives. Trust me, I 100% get it. To be perfectly frank, my brother is currently on Suboxone, and it's saving his life right now. He has been actively using substances for 3 decades, and this is the longest amount of clean time with MAT that he's had, and it's been 5 months. So it's honestly saving his life right now. So I am all for MAT. It's saving lives right now. So, if MAT wasn't a thing, my brother wouldn't be with us right now, honestly. So medication assisted treatment is the use of medications in combination with counseling and behavioral therapies to provide a whole patient approach to the treatment of a substance use disorders. Medication used and MAT are provided by the FDA, and MAT programs are clinically driven and tailored to meet each patient's needs. Improves patient survival, increases retention in treatment, decreases illicit opiate use and other criminal activity among people with substance use disorders, increases patients' ability to gain and maintain employment, improves birth outcomes among women who have substance use disorders and are pregnant. My brother now goes to work every day. For the last 5 months, he doesn't call off work. He has money in his bank account, and he talks to me almost every week, which hasn't happened in 3 decades. It's amazing that MAT is giving him the ability to be a member of society again, because he was not a member of society for the last 3 decades, I can tell you that. So, multiple pathways of recovery. So I've talked to you today about a lot of what kind of my pathways are, and they're highlighted in blue here. So inpatient rehab, outpatient rehab. I talked a little bit about the halfway house. I've also been to 3/4 houses and 7/8 houses. Those are sober living houses where you go and stay, you pay rent. But like there's like rules. You have a curfew, you go to 12-step recovery meetings, you do chores, you mop the bathroom, you clean the kitchen. Those are things you have to do in order to stay there. So you gain some accountability and, get you on your feet before you go out and live on your own. Medication, MAT, abstinence-based recoveries, support groups, and then family therapy at the bottom. That's all part of my recovery pathway. There are many recovery pathways. And we, as a whole, as a society, need to respect all pathways of recovery. And we kind of call these recovery capital. We learn about this in CRS trainings, and we need to implement this more anywhere we can. Recovery capital is all about it's the volume of internal and external assets that we can bring to bear to initiate and sustain recovery. So think about it like the more you have, the better you are. So this can go as far as having caseworkers, peer support, natural supports become huge in this too, community supports, family or friends, supported employment programs, OVR, blueprints, single county authorities, stuff like that. The more you have, the better off you are. Just think of it that way. And then you have all the other ones that I have listed there too, with smart recovery, harm reduction, and so on and so forth. So this is nothing like the earlier picture. I hope you can tell the difference. So my son he's probably 13 there, but he's 14 now. So I always tell him my Palomino trout is bigger than his. And so my son and I have a relationship today is what this comes down to because of recovery. I don't have this relationship with him without recovery. It's as simple as that. We do fun things like this, but I will tell you this took a lot of time to build this relationship back. It took a lot of time. It took commitment. It took building trust. It took, it took as much as sending him a calendar every month saying, this is when I'm going to pick you up. I'm in a co-parenting relationship with my son's mother. We're not together, but I send him a calendar every month and say, these are the weekends I'm getting. And so you know this ahead of time. And it took showing up those times, not canceling. Because the thing is when we're in addiction, we burn bridges. That's just what happens. That's just what we do. But in recovery, we have the chance to mend and build those bridges back up. And I've been able to do that with my son. And it's amazing. It really is, because I never thought I would get this relationship back. I thought it was doomed. But recovery honestly does give us our life back. It's amazing to see it happen. It doesn't just happen to me. Like, people think they're doomed when they come into recovery, that their life's over. But over time, and that's the thing, these things take time. And I think Jamal is even going to touch on this, that like when we are working or our kids are going through stuff, we have to be willing to sit through and be patient with these things with our children or with the people we're supporting. There's a video by Brene Brown. It talks about empathy and sympathy. And it's like a couple minutes long. It's a really good video. I'm sure a ton of people have seen it, but it talks about someone being down in this dark hole and then the person like talking to that person being up top here saying, oh, that sucks. You're down in that hole. I feel bad for you. Feeling bad for someone in that hole is not, that's kind of like sympathy. Oh, I feel bad for you. Empathy would be going down in that dark hole and sitting with them in that darkness. That's what we need to do with the people that we're supporting, with our kids, stuff like that. And that's what I've been able to do for him. And he's even done that on the flip side for me. And that's just what I try to think about when going into this work. Recovery's given me my family back too. As I said, my family has been through some stuff. My dad was very strict. He has lightened up over the years. He's a little older now. He's in the middle on the right-hand side. He did have cancer. He is in remission now, thank God. My parents are divorced. My mom's in the left-hand picture. My brother's on the left-hand side of both pictures. But, I have my family back. My family has never given up on me through this process. So here's the thing. Some people's families do give up on them, and I fully understand that. but your family doesn't have to be actually biological if you're trying to reach support. And it says it right in the definition down there. Family is identified as a group of connected people bound by ties of affection or obligation or both, most often biological, which in this case, the pictures show is biological for me, but anyway, legal kin or legal guardian, but often including other significant people. Here's the most important part of this, as determined by the individual. The people identified as family members for an individual may change over time. So the most important part of that statement is as determined by the individual. So it doesn't have to be biological. I just wanted to point that out. That's very important. I have my biological family, but like I have family people that I have consider family in the 12-step fellowship and the meetings that I go to. I have a very close knit work family that I work with at PMHCA and Youth Move PA. I have a lot of support. Natural supports are so big in recovery. And that's one of the biggest things in working with youth and young adults, that we should be supporting them in building a natural support system, because they find supports in the community with caseworkers and peer support and supported employment programs. And there's a lot of those out there. But what I found working in direct service is they don't have a lot of natural support. So that was one thing I tried to do when working in peer services, was supporting them in building a natural support system becomes huge. The last thing I'll hit on before handing it over to Jamal is identifying your triggers and stressors. And this can be, you hear it all the time, I feel like, people, places, and things. At one time, people was my brother. I couldn't go around my brother when I was in recovery, when he was still in active addiction. I can go around my brother today, which is great. But people was going to be individualized for the individuals who we're talking about. Places, I used to not be able to go down to Pittsburgh because that's where I used to go to get substances. And this could go for mental health too, people, places, and things. If certain places make you uncomfortable, give you anxiety, you would want to avoid them. I mean, it's pretty logical. Certain things, you would want to stay away from certain things. You know, you wouldn't want to put yourself in a bad situation if it makes you uncomfortable. I think I'm ready to hand it over to Jamal. You want me to switch the slide, Jamal?
Yep, advance the slide for me, Kev. Thank you.
Yep.
So we just heard Kev talk about his story, and I love Kev because he is very vulnerable when talking about himself, and very open, and makes you see all of the things that he's actually going through to get to where he is today, and is really a testament to the man that he is. But his story isn't what I would call unique, maybe in some of the things and the interpersonal things, but by the numbers and looking at it, Americans aged 18 plus, so this would be considered adults, right? 9.2 million Americans suffer or deal with dual diagnosis or co-occurring disorders. That number on the right, 45% Americans suffer from co-occurring disorders. I don't think that's a correct number. I think that's a estimate just based on how many youth and young adults may not be considered in this poll, and how many people actually go undiagnosed with mental health. Like Kev just said in his story that he didn't get diagnosed with his mental health until he was 33 years of age. And a lot of people in America do walk around with worldwide with undiagnosed mental health issues. If you can advance the slide for me, Kev. And Kevin talked about some of these things. Speaking particularly to youth, I worked for 17 years, I worked at a residential treatment facility right outside of Philadelphia. And one of the biggest things that I noticed, things that I dealt with when working with the youth, I worked on the drug and alcohol unit, was that they didn't think they had issues. They didn't think they had addiction issues. They didn't think they had mental health issues. A lot of the youth that I came in contact with were in placement for the first time. It was the first time that they actually saw a doctor for their mental health issues, and were diagnosed and had the option to use MAT to start to deal with some of the issues that they had. That said, very few youth will run up to you and say, I'm having a hard time with something. And as parents, loved ones, people in general, I think we have a habit of just checking in with people, but not really noticing them, if that makes any sense. Like the thing that I compare it to is just walking down the street and asking, or bumping into people and asking, is everything good, or how you doing? And I'm fine. Is that comeback? It's hard to notice some of these signs and symptoms if you aren't really paying attention to people and you're just listening to them say they're good, or they're fine, or everything's okay. It's hard to see the changes in people, which is why I value relationships so deeply. Relationships are big. You get to know people, you get to know the things that you're used to. You get used to them doing certain things, and when they change, or you don't see them as much as maybe you used to, or they're not smiling and laughing as much, you get to ask, more intimate questions and things of that nature. So some of those signs and symptoms could be from mental health and or substance abuse. So you want to sort of pay attention to the people who you love, especially our young people out here, because it's hard. Growing up can be a very difficult thing. And when you're dealing with something that you don't know is actually something, you start to turn to other ways to cope. So, Kev, you can advance the slide for me. So support, and what does that look like? I was just saying, you want to be attentive. If someone well is struggling, you'll notice if you care to. I have this conversation with someone the other day, and I'm saying that, growing up, even me, and I didn't deal with any mental health growing up. I never dealt with any addiction issues, but my mom would go to work, single parent home. She would come home from work. She's tired. She would cook when we were young enough and needed her to cook. But once we got a little older, we were, self-sufficient. So me and my siblings, we fed ourselves and all of that. She would check if the house was in order, everything was fine. We didn't have any issues. She would go to bed. She'd get up early, go to work, get home after 5, 6 in the evening, feed herself, get ready for the next day, and she would go to bed. And we knew that. But as long as the cops wasn't knocking on the door, everything was fine, and it to the eyes. But I mean, me and my brother, my sister, we'd be out doing whatever we were doing, and we're kids. Kids get into things. We were terrified of my mom, so we tried not to get into anything that was too terrible. But for the most part, if you don't have those questions like, do you have homework? You know what I mean? And you're not doing homework, or the kid brings home the report card, but never got asked the question of, do you have homework? But he's bringing home bad grades. It's one of those things. It's a partner relationship. You have to check on those things beforehand, sometimes before they get out of hand and run down into that hole. So ask the questions. Don't settle for I'm good. What does I'm good mean? Give me a feeling. Tell me about your day. Something. Have a conversation. And even if it's uncomfortable, sit there. Have the conversation with your child. It's important nowadays more than anything. Listen, sometimes we get into this habit of talking with people and listening to respond. Active listening, I tell people all the time, is a skill. You have to practice it. And it's about actually listening to the person that is speaking to you and understanding what it is that they're trying to tell you. It's not trying to solve their problems. It's not trying to be a superhero and make them feel better in a moment. It's not about trying to help. A lot of times we get ourselves in more trouble doing those things than we are by just listening and responding with questions to make sure that you heard the person correctly, and then figuring out what you need to do for that person from there. Asking them the questions: how would you like me to help you? Do you want me to help you? What do you think you need in order to fix this? Those kind of questions to help people. And then lastly is be patient with people. It's hard because it's like Kevin said, when you are dealing with mental health and or co-occurring disorder, where you have some substance abuse issues, we want people to be better right away. We think that you should get it right away. You enter into help and we set up all of the things, and then it goes left and it doesn't work, or you fall off the wagon. And it's hard to watch as a loved one when you see people doing these things, and it's like, why are they constantly hurting themselves over and over again? And it gets frustrating. Be patient with people. It's hard. Like Kevin said, this is a lifelong journey. This isn't something that just happens. These aren't things that we just do. It's one of those things that you always have to check and balance as you move through life. So be patient with people, be understanding, because your judgment, your lack of care can really push someone who is going through a tough time further down a path of destruction, and that's what we want to avoid. So my big thing is, do not blame the individual for their circumstances. Things are hard when you're dealing with a mental health diagnosis, when you're dealing with substance abuse issues. You don't want to be there. At some point it's all fun and it's games and it's all of those things. It's like, just like Kevin said, like, you're just or a lot of our youth think like they're just doing it to sort of take an edge off. They don't see that it could be a problem in the long run, or that it is a problem currently. They're just doing it to cope. And so, you blame them for all of the things that they're not. And it makes them feel worthless. And it makes them think to themselves, see, this is what I'm saying, nobody loves me, and I'm worthless. I don't have any hope. And all of those things just add and pushes them further away. And then they need to cope with those feelings and those emotions, and they do it in a negative way. So we want to, don't blame, don't judge the individual for them circumstances. try to understand where they are, try to get them to understand that you do care, and that you want to see them do better, and that they have to want to see themselves do better. And how do they do that? Help them with those things, and the potential for them to get help and get better faster exists. So that's sort of my 2 cents. Like, and from what I see, what I've seen working in residential treatment, a lot of our kids just they need somebody to notice them and to give them support, because from where coming from, their backgrounds and the different things that they've all experienced as individuals, has taken them to a place where they feel lost and they don't know what else to do. And so they self-medicate and they try to take those things into their own hands. And the reality of it is that they're just trying to feel good. So trying to get them to feel good and to feel hope, feel good about hope and what their life can be, was a lot of what I did. And it wasn't I always tell people, my trauma didn't make me, even though I'm fine with who I am now, and I'm proud of the man that my mother raised. There's a lot that happened to me when I was a child that I don't do with my son, as a result, because I know better. And so my trauma doesn't make me, and I don't want you to have to deal with the hardness of life to get to where I'm at. There's a different way, there's a better way. So if you're working with youth and young adults, always remember that part. And there's a better way, and being hard, stern, and looking at things in a way where you're always punishing isn't always the right way to go. So I'll pass it back over to Kev, and he will finish out the presentation.
All right, we got 2 more slides and then we're gonna take questions, I believe. So hopefully you've heard of post-traumatic growth. When we like to introduce this because one, I think it becomes very important because when you're talking about substance use and mental health, trauma becomes very prevalent. So when you're talking about trauma, post-traumatic growth can also be very important to talk about. So what is post-traumatic growth? And I think a very short and sweet definition, not definition, but a phrase to go with it is it's all about growing through what you go through. So if you look at this, I'm just going to explain what this diagram is, and my coworker kind of drew this up. So say you're on the left-hand side of this and you're just going about your everyday life and something happens, trauma happens, domestic abuse, physical abuse, sexual abuse, something happens that causes you to go down into that trauma pit. So it depends on how long you're down there. You could be down there for 6 months, a year, multiple years, decades even. I mean, it honestly depends on what's going on. How do you get out of there? What you get out of there with wellness tools, resiliency, whatever it may be. For example, some of the stuff that happened to me, I really didn't get into the nitty-gritty stuff that happened to me with some of the traumas I experienced, but for me, it was wellness tools and resiliency. I did therapy. That gets me up some steps. I did 12-step meetings. That got me up some steps. I did build a natural support system. So that got me up to back to normal. Let's call it baseline. So after that, I started doing some more things. I started getting into some hobbies and some other wellness techniques. That got me up some more steps. Before you know it, you're getting up way higher than you were when you started back at life or even back at baseline. That's called post-traumatic growth. So we're way higher and up on the scale than when we even started back at original at life. It's pretty cool how post-traumatic growth works. So we just talk about it because you can find that in a lot of people's stories. And I definitely find it in my story as well. So I encourage just everyone who interacts with people to kind of throw the golden rule out the window and start living by the platinum rule. And I think we all have heard of the golden rule: do unto others as you would have them do unto you. So it's like, I mean, it implies that you already assume how they want to be treated because they want to be treated how you want to be treated. You don't really know that, though. That's the thing. So the platinum rule goes, treat others the way they want to be treated. So the way you find that out is you have to ask them. So first understand what they want, and then I'll give it to them. So I just encourage everyone to throw that golden rule out and to live by the platinum rule. I think that becomes very important as parents, caregivers, support people, as people working in the field, mental health, substance use. I think it's very important to kind of have that mindset when we're doing what we do and interacting with people as a society. I think that is about it. That's my contact information there. I'm sure put Jamal's in the chat maybe. If not, I'm sure you probably already have it because he does these webinars all the time.
Yeah, Nancy is good at that. She'll make sure that everybody has whatever contact information that they need.
Absolutely, very important.
Put that in the chat. So
I want to thank both of you. I'm sorry I missed some of you, Jamal. Some of you may have noticed that Zoom kicked me off, which was quite rude. But I'm back, and even though I've heard it all before, I could hear it again. It's what the both of you had to say, what is so critical in understanding what's happening with our youth and young adults today in the world. And what my amazing grandmother taught me, which is for all of us, is to lead by example. Don't tell anybody what to do, just be an example. And you guys sure do that, and I appreciate it. And I have a question for Kevin that, since I can interrupt, I would like to present to Kevin. As I was listening to you, Kevin, talk about your son, and I think we're all in agreement that he is the cutest guy. And we enjoyed those photographs very much. And I thought to myself, so what's Kevin going to do now that Kevin is the person with lived experience and knows better than anyone what a boy child could be going through? What is it you look for with your son, if this is not too personal, and would suggest to others that they do?
I will get super vulnerable right now and tell you that my son is experiencing something that I was like, that's interesting. His mom just told me. He has something. So before I even picked up a substance, I had issues with being infatuated with money. And I find that's us as people having addictions, or, we find that we've had this thing in us before we've even picked up the substance. So my son is having an issue and an infatuation with money. He is gambling on apps on his phone. So I'm coming to find out that he's having a gambling addiction at 14 years old. So with that being said, it kind of goes to your question, I believe, Nancy, that, you know, I've been open with him since I started rebuilding this relationship that, you know, I am someone in recovery. This is what I do for my recovery. This is one of the most important things to me because it gives me the life I have today. It gives me the relationship I have with you. If I don't have my recovery, I don't have this relationship with you. So what I tell him is that, like, this is why I do these things. This is why I do therapy. This is why a 12-step meeting. This is why I need to go to this 12-step meeting on this night, because this is important to me. So when I talked to him about this gambling thing, you know, I talked to him, let him know what's going on, what that could potentially lead to, and then I shut up and listened to what he has to say. Because a lot of people in those situations, I think Jamal and I kind of talked about it, will talk to the kid or talk to the young person, and they will continue to talk. And the problem with that is you have to be willing to, we talked about being patient, being able to listen. That's what we have to do as adults. We have to take the cotton out of our ears and put it in our mouth. That's a saying that we hear often, because with the cotton in our ears, we can't hear. So take the cotton out of your ears, put it in your mouth. That's like the approach I've taken with my son. I really need to listen to what he's saying, because if we're not listening to what our children are saying, we're not going to know what they actually need. So
That's absolutely terrifying, Kevin. At 14 years old, to be able to understand what a gambling addiction means, that seems like it's pretty close to impossible, and a really challenging job for you. And
yeah,
I'm glad that you feel ready to listen, and that is the most important message in all of this today, is to listen.
yeah, it's tough. It's tough, but you know.
I think you've got it handled, though, Kevin. I think you've got this.
Yeah.
You know, and it goes to, you know, and this is a lot of what I had to deal with when I was working in residential treatment. A lot of the youth that come through there, they don't believe at what they're doing is addictive, or that they are addicted. Even if they don't have quote unquote substance abuse addictions, they have addictions. And I used to try to explain it to them. Addictions have highs and lows. There's really no in between when it comes to it. You're either high or you're low, you're up or you're down, right? So if you're gambling, you're winning, you're high. If you're losing, you're low. If you're doing drugs, literally you're high or you're low. You know, it's the same thing. And I used to tell them, so what are you addicted to? I just like the money. Well, it seems like you're addicted to money. What else do you get out of it? I get a rush. It's the adrenaline. So when you're out there standing on the corners and you're doing all of these things, you're addicted to the lifestyle. You know what I mean? So why? You start to figure out those reasons why. You start to have those conversations, and you start to understand them and the reasons that they're doing the things. You know, it could be, you know, multifaceted. But if you don't have the conversations with them to understand the reasons behind, and you're just telling them you need to stop, that doesn't work. It just doesn't work.
It's never, Jamal, I just want to add to that, you know, from my own lived experience, which is nothing in comparison to what you've been talking about, but my addiction is food, and the connection between food and stress. And it's taken me a long time, and I'm at a point right now where I think for the first time in my life, I have it under control. But what I've learned from that is it is so complicated. It's not just this one thing. It's not that he likes money. It's that he maybe feels this way about that. And it just goes on and on and on. And it's like the biggest onion in the world as you're trying to unpeel it and figure out what's going on underneath. And it's doesn't go, which is why I needed to say in the beginning, and it doesn't go away. You deal with it all the time for the rest of your life.
Mhm. Yep.
So I want to get to some of the questions that people have posted in the chat. One of the questions, Kev, is from Patrick. Wanted to know if you have any comments about parents who are concerned about their children because of behavioral issues and problems, and sees the solution being to sign their child up for a medical marijuana card, which, just to say, our grant, we don't, support, marijuana in its various uses, but we do understand that, coming with our youth and young adults, there's a lot of different things out there, that a lot of different quote unquote therapies that exist now that weren't options when I was a kid. So when you have any thoughts on that, Kev?
Yeah, I don't know. I just think there's so many other options and other routes you could go, I don't know. That's just me. And see, I come from substance use world, so that's a tough one for me. It really is. I just think there's so many different routes you could go. So it's a tough one for me.
I agree. It's and like I said, I think all of these things are individual, and I pass no judgments on anyone, but for me, especially when you're talking about, behavioral issues, I'm not sure what exactly those behavioral issues would be, but to use a substance to control it without a prescription, like is that MAT? I don't necessarily think that would be MAT.
Yeah, I don't know.
So for me, that's a hard one. Next question is from Stephanie. She wanted to know, were you open with your son about your addiction and mental health issues?
Yeah, so my son's mother, which I don't blame her, probably didn't talk the best of me when I was not doing so well. So like I said, when I was presenting, it took time to build that relationship back. So as I didn't, once I found recovery, it took time. Like I didn't get him one-on-one for a very long time, probably the first year and a half. Like I would go with my mom or my dad to pick him up because, to be honest, no one trusted me with him, to be alone with him. So, shortly over time, once I started getting him one-on-one, I started telling him slowly but surely, I'm in recovery. I go to 12-step meetings, because I was addicted to this, for many, many years. When I lived at home with you and mom, I was addicted and I struggle with mental health. So yeah, he knows to this day, he knows everything now. So I've been pretty open with him about everything.
Yeah, Dom's a great kid too. This next one is from Rachel or Rochelle. Why do you think it took so long to be diagnosed with a mental health disorder, Kev? What were the DNA providers missing? Was it anything that you could see that might have that led to you being diagnosed so late in life?
Yeah, I probably wasn't. So for me, I probably wasn't communicating it very well, that I was struggling. So it probably wasn't all their fault. You know what I'm saying? I probably had some struggle in communicating what was really going on with me. The other part of it was I wasn't too open-minded about having a mental health problem. So I think there was a lot of parts, to play, and it wasn't just the provider's fault is what I'm going to say. I definitely probably had a part to play in it. I struggled to communicate. Like, we're taught not to. There's stigma. Yeah,
Yeah.
I mean, I didn't want to say. I didn't want to share my true feelings with how I was feeling. I know that to be not true today. Like, I definitely share what's going on with me today, but back then, man, like I did
Especially,
not want. I did not want to be honest with how I was feeling.
especially growing up as a boy, in the time, when we grew up, being a man, these are the emotions. What's those like? Sharing your feelings and feeling like you might have been, what I mean, you get looked at a certain type of way. So I can understand where, that might have played a role also. That toxic masculinity.
Mhm.
Anna asked, in your opinion, how do you help someone that thinks they don't have a mental health diagnosis or issue problem?
That's interesting. So I used to see a peer when I was working in direct service. He was diagnosed paranoid schizophrenia. He did not think that was his diagnosis. I still went and saw him every week. We still support them, still be there for them. Do anything you can to be there and support them. Don't treat them any other way, differently, I should say. That's my advice.
Yeah.
Be there for them. Don't treat them any differently than you would normally. And
Agreed.
encourage them to reach out when they need to reach out.
Yeah. I think it's more about, it's not so much about what they do. It's about what you do. It's how it's everything is about how we respond. And if someone doesn't think that they are experiencing something, but you see that there's something a little off, just because they don't think it's something that's a problem for them doesn't mean that you withdraw your support, right? You continue to support, and hope that they come around to seeing things in a different light and maybe are more open to looking for help, or asking for support. So I think it's just about us as individuals, even if when the person doesn't feel like they have an issue or a problem, it's about us still being supportive and being there for that person. So Mary had a question. When does support become enabling the behavior and keeping them from being accountable for their choices?
That's a good question.
Mhm.
So you can. I usually say this when I do this kind of presentation. There's different kinds of enabling, like on the substance use side, you can enable with money or you can enable with love. You can enable someone to death on the substance use side. And that almost happened to me. My mom her way of showing love is through doing for, or money. And like, she didn't know any better back then. So like, if I would have robbed the store right in front of her, nope, he didn't do it. That's when it becomes sketchy. You have to watch how much you're doing for people. I should take that back. You don't want to do anything for people. You want to support people.
Yep.
That's one of the biggest things. If you notice you're doing things for people, that's when it becomes enabling. If you're supporting, coaching, teaching, that's okay. Once you're doing, you definitely cross the line.
And that's, I think, the big thing. Enabling is not supporting.
Yeah.
Right. And that's the thing that I think we need to understand the differences in those things. Enabling is continuing the behavior, right? Allowing the person to continue the behavior. You're actually helping the person to continue the behavior. Support doesn't look like I'm going to give you money so that you can go get high. If you're hungry, I'm not just going, if you tell me you're hungry, but I know I feel like you want to just get high. Support is me saying, well, come on over, let me cook you something, or let's go to the store and let me grab you a burger or something. I'm not physically going to give you the money to allow you to go get high. I'm going to feed you because I want to see you get through this. If you're hungry, I want to see you full, but I'm not going to just give you the money because I know you're going to use it to go get high. That's the differences in support and enabling in my eyes. So understand the differences between the two. And when you feel like you're helping somebody to continue a negative behavior, you may want to withdraw, look at that and withdraw how you support that person in that way.
Jamal, we're running out of time.
Oh, look at that. It's 1:28. So, Nancy, you want to close us out?
Yes, I want to thank everyone for being here, for your deep, heartfelt participation, for your wonderful questions, for your concern, for your desire to do good and do better. And I think we learned a lot today from our friends Kevin and Jamal. And I thank them, for giving us their insight, wisdom, and time. And I'd like everyone to know that our next presentation is Thursday, June 8th from noon to 1:30. It is supporting members of the LGBTQ plus community. Missy Peters, Brittany Feaster, and Bella Davis of Blair County will speak to us about their work in the LGBTQ plus community, representing a member of the community, being an ally of the community, and the insights of teams. And I also think there's going to be another speaker joining us too. So it's going to be a great conversation. And again, let me thank you all for being here today.
Thank you.